Throughout a normal workday, your hands are in constant motion. They touch patients, equipment, food, most everything in the environment. This constant activity is necessary, but it increases the possibility of spreading bacteria or other germs. The desired outcome for any patient entering a healthcare facility is to leave without experiencing complications from infection. That's why hand washing is so important. It is the single most important way to prevent and control the spread of infection. In 1848, Ignaz Semmelweis, an Austrian doctor, first discovered that infection was being spread by the hands of healthcare workers. Doctors were performing autopsies on victims of childbed fever. Without washing their hands, they would return to the wards to perform deliveries and provide care to unaffected mothers. This resulted in the spread of infection by cross-contamination and the death of many new mothers. Semmelweis's theory was not acknowledged by the medical community until years after his death, but came to be very important in understanding how infection is spread. In today's healthcare environment, cross-contamination is still a concern. We perform many invasive procedures outside of the operating room, some at the bedside. We've seen the development of resistant strains of bacteria and the newer blood-borne pathogens such as the AIDS virus. The significance of hand washing in the healthcare setting cannot be underestimated. According to a survey by the Centers for Disease Control, 1/3 of all hospital-acquired infections are preventable. This translates into over 26,000 preventable infections a year, 800 preventable deaths, and a potential savings of $25 million. Effective hand washing can save hundreds of lives and millions of dollars. To prevent the spread of infection, hand washing must become a habit that is part of every worker's daily routine, beginning with when you come to work. Before coming to work, your hands may contact a variety of unclean surfaces. Considering where your hands may have been, it's obvious you need to wash when you arrive at work. The type of work you do will determine how frequently you should wash your hands. If you have direct patient contact, your hands should be washed between patients and even between some activities with the same patient. Many activities require wearing gloves, but these gloves do not offer complete protection from contact with germs. Therefore, hands need to be washed even after removing gloves. If your work does not involve direct contact with patients, hands should be washed after any contact with obviously unclean surfaces. When you take a break from work to perform personal functions, such as combing your hair or using the restroom, you must wash your hands thoroughly before returning to work. It's also important to wash your hands both before and after eating lunch or having a snack. Clean hands not only help stop the spread of infection at work, but can help prevent bringing germs home as well. Therefore, washing your hands prior to leaving work should also become part of your daily routine. Good hand washing technique is quite simple, but it requires more than just getting your hands wet and dry. Begin by wetting your hands and applying soap. Work up a lather and apply friction to all surfaces: the palms, backs of hands, and between the fingers from both sides. If you wear rings, leave them on when you wash and lather thoroughly underneath the ring area. Apply friction to the thumbs and to the wrists. Effective hand washing requires at least 10 seconds of friction. As you rinse, make sure the soap residue is completely removed. Thoroughly dry your hands using 2 or 3 paper towels. Remember, the faucets are contaminated, so always use the paper towels to turn off the water. The length and care of fingernails is also important. Long nails or rough edges provide an area for germs to hide. Fingernails should not show above the tips of the fingers and should be carefully filed to maintain a smooth edge. When you wash, remove any dirt and debris from under your nails. As you rinse, pull your finger away from each nail and rinse thoroughly. Frequent hand washing can cause damaged skin. Cracked, rough, or dry skin provides added hiding places for germs. Lotion is needed to maintain good skin condition. Apply only when hands are clean, as needed throughout the day, and especially before going to bed, when it remains on the hands and can be most effective. Your hands are used in almost every work activity you perform. They are easily contaminated and provide an excellent means of spreading infection if they have not been properly washed. Good hand washing can dramatically improve the quality of patient care if every healthcare worker makes it a part of their daily routine.